Meet Adrian, a 49-year-old, admitted 3 days ago with severe sepsis from a perforated bowel. Surgery repaired it, and antibiotics were started. Instead of improving, he was found gasping for breath and clearly panicked. Notice, Adrian's symptoms developed within a week of his illness, which is a key detail. He has refractory hypoxia, meaning his oxygen keeps falling despite increasing supplemental oxygen. He's breathing fast, with chest retractions, secretions, crackles, and rhonchi. The chest X-ray reveals diffuse bilateral opacities, distinguishing ARDS from pneumonia or heart failure. His PaO2 to FiO2 ratio, a measure of how well his lungs are oxygenating his blood, is below 100 millimeters of mercury, confirming severe ARDS. Interpret. Acute respiratory distress syndrome, ARDS, is a form of non-cardiogenic pulmonary edema, fluid buildup in the lungs caused not by heart failure, but by inflammation. Inflammatory chemicals attack the alveolar capillary membrane, the thin barrier separating blood vessels from air sacs, making it leaky. Fluid floods into the alveoli, destroying the surfactant that keeps them open and causing them to collapse and scar. As the surrounding tissue is damaged, the lungs become stiffer and harder to inflate. These same chemicals can spread to every organ, causing multiple organ dysfunction syndrome, MODS, which is the most common cause of death in ARDS. Triggers include direct lung injury or indirect injury from a systemic condition like sepsis. Respond. Treating the underlying cause, sepsis in Adrian's case, is critical to stop the damage. He also needs intubation and mechanical ventilation with smaller tidal volumes to protect his fragile lungs. Sedation and sometimes paralytic medication eases the workload of the lungs and prevents him from fighting the ventilator. Prone positioning helps reopen collapsed lung regions. ECMO, an external machine that performs gas exchange for the body, is used when the ventilator alone isn't enough, essentially dialysis for the lungs instead of the kidneys. Supportive treatments include corticosteroids, bronchodilators, and pulmonary vessel vasodilators like prostaglandins and inhaled nitric oxide. Reflect. If treatment works, Adrian's oxygen improves, breathing eases, his chest X-ray clears, and he's gradually weaned off the ventilator over days to weeks, though scarring may remain. The most serious complication is MODS, which can cause the kidneys, liver, brain, heart, or gut to fail. In summary, ARDS is a lung injury in which inflammation damages the alveolar capillary membrane, flooding alveoli with fluid, collapsing lung tissue, and causing severe refractory low oxygen. It follows an injury or an illness like sepsis and can progress to multi-organ failure. Treatment involves addressing the underlying cause, low tidal volume ventilation, prone positioning, and ECMO in severe cases. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.